My name is Amal Mohammed. I'm doing diabetes diploma in South Wales University. I will talk today about microvascular disease and diabetes. Diabetes is a chronic condition characterized by high blood sugar level, and currently its prevalence is increasing, and that's lead also to increase in its complications, especially type 2 diabetes. The vascular complications are a major cause of long-lasting disability and death in patients with diabetes, and also can dramatically lead to impairment of the quality of life of the patients. Regarding microvascular complications, the microvascular complication mean the damage to the small blood vessels in several organs. And today I will talk about the three common microvascular diseases briefly. So, this damage to the small blood vessels is due to a long-term high blood sugar, which is playing a major role in the development of these complications. But also there is another risk factors contributing to the development of the microvascular disease. These include old age, obesity, lack of exercise, intake of unhealthy food, high blood pressure, high blood lipid levels, and also family history of diabetes or genetic predisposition. I will talk briefly about the nephropathy. Nephropathy is the affection of the small blood vessels of the kidney, and that leads to damage of the kidney tissue, which can lead to chronic kidney disease. And also the diabetic nephropathy is a primary cause of end-stage renal disease and may require renal replacement therapy, which is dialysis, and sometimes kidney transplantations. The rate of the diabetic kidney disease is higher among type 2 diabetes patients, and the diabetes itself is the most common cause of adult kidney disease in developed countries. The first signs of damage to the kidney is what is called proteinuria. Proteinuria is an excessive secretion of protein in the urine, and that increases the risk of heart problems. And also there are different degrees of glomerulosclerosis, which is a calcification of the kidney tissue, and also tubular fibrosis, which is a scarring of the kidney tubes. And these causing hypertension, and which is a high blood pressure, and renal atheroma, which is an arterial thrombosis or clots, and ischemia, which is the death of the tissue. When talking about diabetic retinopathy, that means there is a damage to the blood vessels of the back of the eyes. Retina is the back of the eyes. So that leads to a growth of fragile and poor quality new blood vessels in the back of the eyes, as well as a swelling of the macula, which is part of the retina. And these can lead to severe loss of vision or blindness. Retinopathy is the most common cause of loss of vision in adults in the developed countries. In England and Wales, diabetes-related vision loss affects 7% of newly registered blind individuals. 2/3 of type 2 diabetes will have retinopathy to some extent within 20 years of their diagnosis. Now, diabetic neuropathy. Diabetic neuropathy, the high blood sugars or uncontrolled blood glucose causing abnormal and decrease in the feelings or sensation, which typically affect the feet first, but may also affect other nerve cells, and later on it's commonly affecting the hands and fingers. The diabetic foot, it can be related to neuropathy, which include the pain, ulcers, and sometimes might lead up to limbs amputations, which is the loss of the limbs. It is estimated that the diabetes neuropathy is affecting up to 50% of people with diabetes, and commonly present as the distal and symmetrical, or we call it bilateral neuropathy. Related to the peripheral neuropathy, there is what is called painful neuropathy. The patient might having a symptoms like numbness, burning, shooting pain, tingling, loss of sensations of the hands and feet, typically in a distribution of stocking and gloves. And the patient might have these symptoms mainly at night. And it may eventually turn from on and off symptoms to persistent painful neuropathy. By the end of this presentation, I will talk about the management briefly, but the core of the management is a good control of the blood sugars, which means to have a good management outcome. But also we need another risk factor to be well managed. Like the blood pressure, we need a good blood pressure control. And also if the patient have a high lipids profiles, we need to manage his cholesterol. Also, education is very important in this instance, and it's also one of the important elements of the management in the education, and also the lifestyle modifications, which including physical exercise, good nutrition, and loss of weight. And by this we come to the end of my presentation.